So I'm Shelley Bear, and I'm the Director of Leadership Training Initiatives at the University of Miami Miller School of Medicine at the Mailman Center for Child Development, which is our LEND and our USAID. I run leadership programs for the disability community, for young adults with disabilities, for professionals that want to create systems level change for people with disabilities, and high school students with and without disabilities. And I'm a clinical social worker by my training, and I also have a visible physical disability.
Hey, and my name is Ashley Falcon. I am an assistant professor at the University of Miami School of Nursing and Health Studies. I actually was in one of the cohorts of one of Shelley's leadership trainings, our emerging transformational leadership program. And that's how I got familiar with this line of research for myself. And so we've been working together to kind of put together training resources and whatnot, things that we feel would be useful. And that's part of a larger umbrella that captures the conversation of today's topic.
So what do we want to share with you? So as we know, COVID-19 for the last 12, 15 months has really created a crisis, especially for the disability community. And in the beginning, there was a lot of fears and worries and concerns about the limited medical resources, specifically related to ventilators. And they thought there may be shortages for the ventilators. And the disability community was nervous and worried that our population may be left out of the conversation or may be unfairly discriminated against because of their disability. And because we know there are implicit and explicit biases and stereotypes around this topic around the disability community. So there were policies, and most states realized that they didn't have a crisis standard of care policy for exactly this kind of issue. And then there was limited trainings for healthcare providers to help educate and maybe eliminate some of the stereotypes and biases that we know exist. And Florida did mobilize, and we came together around some collaborative response mechanisms to improve and make sure that this didn't happen. Luckily, we didn't experience the shortages of ventilators, so we didn't really but this was like a preemptive policy, because we needed to have a policy that hospitals followed. Okay, so we did come together, and our director of the Florida Bioethics Collaborative, who's Dr. Jeff Brosco, who's our LEND director, got together and really put together a statewide policy around crisis standards of care. So all of these things that we're going to talk to you about today and have this conversation all happened at the same time. We were all working together to make sure we had policies in place for hospitals to follow, trainings for healthcare providers, and then the Florida Department of Health was very much involved in a lot of these efforts. And this is exactly what I just said. The Florida Department of Health came together and really brought organizations across the state of Florida, all these disability organizations that you see listed here. We were one of them. And very much in the beginning of the pandemic, we had weekly phone calls with all these organizations. And it was really a collaboration. It was figuring out what to do, what's needed. It was very hands-on. It was really helpful because Florida is a very diverse state. We're down in South in Miami, which is very different than Tallahassee, or more rural communities. So all these agencies were from all over the state of Florida. So we kind of got to learn what other agencies were doing, what the barriers were, what the issues were for the disability community. So this is very positive. So Florida did really mobilize and to make sure that the needs and were meant for people with disabilities and their caregivers during this pandemic, before even the vaccine came on board. Then we kept having meetings about the vaccine because, as we know, there were issues with that. But it was a really a nice collaboration with our Florida Department of Health.
And Shelley, how did these partners come together? Like, what was there a process? Did we already have kind of a way to kind of corral everyone? What was the way of getting everyone together on this effort?
I would have to say that was the Brian Russell, who's the director of the Disability and Chronic Illness portion of the Florida Department of Health. He was the lead, and he had connections with most of these organizations that you see here already in place. So he set it all up. These were the partners that he corralled together, and there were directors there and staff people that were on the ground, doing the work in their respective city. So Brian and his team was really instrumental in gathering all these organizations that are focusing on disability, and some with elderly as well, because there's an overlap. And I thought it was, I think there's Commission for the Transportation Disadvantage. So having all these different resources, then people can reach out to each other. Like we offered assistance too. Like FIU here in Miami was designing masks, like the clear ones. So for people who use sign language, right? The deaf population, they were finding that a barrier. So that was really interesting. So we hooked up and we helped all the other organizations with different resources that we might have known about in our city. So it was really, really productive and helpful. And then this is just what I was just talking about. So the crisis standards of care was created by the Florida Bioethics Network. And their link is below. So if you're interested in reading it, it was a statewide conversation that Disability Rights of Florida, the Florida DD Council, they all reviewed it. So, and I think the Florida Department of Health was involved as well. And they ironed it out, and they had some disagreements sometimes, but it was a really important document for hospitals to have around the crisis standards of care related to disabilities.
Mm-hmm. Yeah, just to add what Shelley is saying, we kind of feverishly thought that we need to put together a training as quickly as possible to kind of address this concern with regards to kind of limited resources and discrimination surrounding them. So we put together a training that was directed towards triage teams, the teams of professionals that would have to make decisions when the time came about who received the scarce resources, right? Ventilators being one of them. So we have the link here for you to see, but I'm just going to quickly run through the content of the training. We definitely wanted it to be interactive, but we definitely didn't make it so interactive because we had to keep it short. We knew emergency time, we knew very busy professionals. They wanted something quick that they could reference and learn from and then move on and apply it. So we chose these 4 topic areas, and we initially created this content based on information that we've been gathering from focus groups and interviews and conversations with patients with disabilities and caregivers. So we wanted some background information, a little bit more on, laws and guidance, what the actual best ways to make objective decisions would be, and then a little bit more with regards to tips and strategies for how to give quality care for healthcare providers. So just to kind of expand on that, the training overall is about 15 minutes, under 15 minutes. So the challenges are talking about giving an understanding of what disability is, right? What the scope of disability is in terms of prevalence, common misconceptions. We do have one interactive piece with an implicit bias test. We really want to encourage people to be aware of bias that they might have and not be aware of, but also encouraging them to reduce their bias through exposure, interacting with people who have disabilities. That's a surefire way of doing that. And stressing the point that disability is absolutely not a deciding factor when making a decision about the allocation of scarce resources. So from there, we talk about laws and guidance that kind of give support to people trying to make equitable decisions, saying that, hey, we have protections, we have guidance already in place in general, but also specific to, in this case, COVID-19, to kind of give them support and allow them to kind of push for these changes that we know are really important to create these protocols. We also give from there the actual kind of tools and suggestions of how to make that happen. So what are specific objective criteria that are available to triage teams that they could use to score patients and make the decisions? Making sure that you have a disability represented on a triage team, either someone who themselves has a disability or sits on an organization that does disability advocacy work, for example. And then also looking at not just at the individual level and the team level, but the protocol, the policy. So what are the policies saying? Do they actually support the ability to make those objective measures? And then lastly, adding back in best practices for communication, for providing appropriate accommodations in general, but also tailored to specific needs of a given emergency. So in the case of COVID-19, knowing that it's communicable through the air, we want to make sure that we're providing the support services and whatnot that are needed and owed to patients, but doing it in the safest way possible. So those are the kind of the sections of the training, and that kind of wraps up my part.
And Ashley, where has the training been disseminated?
Yes, absolutely.
How do you want to talk about how we did that?
Yes, definitely. Thank you for that. So we definitely leaned on Brian Russell again with his many connections, getting out information through the various partners connected to the Florida Department of Health. We also reached out to AUCD. We have been kind of attending weekly meetings with the Center for Dignity in Healthcare, who've been doing a lot of great work on this and many other topic areas. Now it's kind of migrated to conversations about equity with vaccination, for example. Also through our School of Nursing and Health Studies and our nursing leadership, as well as American Public Health Association's disability special interest group. So really any and all channels we could find, getting out the information that way. And of course, I joke with Shelley that I make all of my students take the training as well. So that's another way that we do that.
And I just want to say too, that we were called on in a crisis to put this together very quickly for the work that I do in the leadership programs. And Ashley, as she said, was part of that leadership. And this was part of their group project. And Ashley is a genius as far as doing these kind of trainings. And we had a small team, myself and two other people with disabilities, right, Ashley, that kind of helped you with the content. So this training was driven by people with disabilities and their allies to get this together. I think it took us 3 weeks to get this all finished and in a crisis.
Absolutely. Yeah, it was a quick turnaround, especially with really supportive individuals coming together to lend their feedback, lend their support, and then disseminate once it was done. So it was a really nice kind of success story in a time of crisis.
And I will say the training is now hosted on the Mailman Center website. The link is in the prior slides, and it's under our continuing education area on the Mailman Center website. So you're welcome to take the training. We really encourage you. We would love your feedback and to see how we can keep on disseminating this important resource for our communities.
Yes, it's free. We welcome feedback. We welcome dissemination, and we appreciate your interest.
And also, just one more little plug. In the training, we have a person, a young man with Down syndrome, who I thought was the highlight of our training.
Yes, Alexander.
I know, Alexander. It's in his own words. His mom was also instrumental in the content of our training, and we we thought he's not shy, so he was the perfect person to give a testimonial. You know, like something like "I am ventilator worthy." It was really nice. So I think we're out of time, but we're enjoying sharing this with you all, and I hope we hear from you for some feedback. So thank you for your time.